Hello everybody, welcome to another iHeart Dental Q&A. I'm your host, Dr. Misty Seal, and I have with me a very special guest, a very special friend of mine, Dr. Ruby Truong with Sweet City Smiles in Sugar Hill, Georgia. So, tell us a little bit about your practice, where Sugar Hill is.
We are a brand new family dental practice in Sugar Hill, Georgia, which is about 1 hour north of Atlanta.
Very nice. So, I asked Dr. Truong to join me here today to discuss a very complex topic of oral hygiene, more specifically periodontal disease. And so a question that I get asked a lot is, why do I need a deep cleaning if I could just do a regular cleaning? So Dr. Truong, take it away for us. Tell us about periodontal disease and about the deep cleaning and everything.
So if the dentist has recommended a deep cleaning for you, very likely he has diagnosed you with gum disease. So what gum disease is the loss of attachment of the periodontium, which is the gums and the bone that is surrounding the teeth.
So how does one know if they have periodontal disease or gum disease?
There are a few signs that you can look for, such as bleeding gums, bad breath, loose teeth. You may also notice that more foods are getting stuck in between your teeth, things like rice or oatmeal, broccoli.
A lot of buildup too, right?
Yes, and also a lot of buildup.
So that brings me to another question. What is needed to treat periodontal disease? Periodontal disease. That's a very hard word to say.
Yes. So how we treat gum disease is with a deep cleaning, or what we call it is a scaling and root plane. But to be honest, the treatment of gum disease is a two-way road. You know, we do what we do as dentists in the office. The scaling and root plane in particular, what that is just the removal of all the bacteria that is deep down underneath your gums. What we also do is teach the patient how to properly clean and maintain their teeth when they're at home and we're not there with them.
Yes, that is very important. So let's talk about that for a little bit more, right? Yeah. So with that, we need to go back a little bit with pocketing and...
Yeah, so, you know, I kind of went over what the signs, what some of the signs that you can look for are, but the best way to determine whether or not you have a gum disease is to actually go see the dentist, who will take a set of x-rays and also do a gum evaluation. For those of you who haven't had a gum evaluation before, what we're doing is we are measuring your gum pockets. Your gums have pockets just like the pockets in our jacket, and we're measuring the depth of them because we want something that you can maintain at home on your own when we're not there with you. And that measurement is anywhere between 1 to 3 millimeters. If the dentist does your gum evaluation and they find anything more than 3 millimeters, what that means is that when you're brushing and flossing at home, you're only cleaning up to the 3 millimeter mark, but everything beyond that, you're leaving untouched. And so you leave it behind and underneath your gums to continue to cause disease and damage.
Right, so essentially your toothbrush cannot get deep enough to clean those areas because the pocketing is too deep. And so you're not getting those clean. And so more inflammation, more destruction, more bad stuff. So what happens over time if periodontal disease is not corrected or treated? What happens?
Well, what happens is you'll start to lose the bone. The bone is very important because that's the supporting structure. That's what's holding our teeth in place, holding our teeth stable. There is a point where you can lose too much bone and the teeth starts to become mobile, and you could eventually lose your teeth to gum disease even though you've never had a cavity.
Very good. Yes, that's a very good point. So even though if you don't even have to have a cavity whatsoever, but if you have periodontal disease, you could end up in full dentures. It is a serious disease. So thank you, Dr. Truong, for answering this question, joining us today. But before I go, I would like to say iHeart Dental is very proud to support Nine Line Foundation. And so for every new patient that comes into the practice, we donate towards these veterans to help them get back on their feet. So thank you for joining us today. #LoveToSmile.
#LoveTheSmile.